So, Doctor, tell me about some of the treatment modalities you offer.
Sure. So what this practice specializes in is minimally invasive treatments, mostly using ultrasound or in-office arthroscopy, as well as regenerative therapies. So the main goal of this office is to keep people out of the operating room. So the old school of treatment, it was you either did therapy, you took some medication. If that kind of stuff didn't work, maybe you did a shot, and if that didn't work, then you did surgery. Now we have a lot of in-betweens where the surgery most times isn't even needed anymore. So we do things with our minimally invasive stuff. We do something called Tenex, which is a minimally invasive tendon debridement. So for things like tennis elbow and golfer's elbow and Achilles tendonitis that haven't responded to the easy stuff, basically what we do is under ultrasound we find those tendons, we find the bad part of those tendons specifically, and then we insert a needle. That needle is connected to a machine that uses an ultrasound pulse. So think of it like a little mini jackhammer, and it breaks up and sucks out all the bad tissue. And actually the way they designed it was that the frequency of the pulse does not break up good tissue, which is stronger, but it only breaks up the bad stuff. Then we are also starting from that same company that made the Tenex machine is doing something called Sonex, which is an ultrasound-guided carpal tunnel release. So, the old school of carpal tunnel was you had to make a big incision in the palm. Obviously, the palm is very sensitive. That skin is very thick. And when you do that, it forms a lot of scar tissue afterwards. Sometimes it could take months to fully recover. This is done with a small needle, an incision this big. You don't even need a stitch afterwards. The carpal tunnel is released underneath the skin, and actually, you put a little dot bandage on, and the patients can go back to work the next day. And then, we also do things, we do something called high-dose laser therapy. And basically what that's doing is it's using laser energy to areas of chronic injury, like chronic muscle injury, even some chronic tendon injury. And that laser energy works a couple different ways. It opens up the blood flow to the area, which more blood flow brings more healing. It also opens up the lymphatic system, which drains that inflammation away. And it actually works at the cellular level to help the cells work better to help repair. So, and then the other thing we're doing is in-office arthroscopy, where we can actually take a needle. That needle has a high-definition camera attached to it. We could put it in shoulders and knees and take a look around, and you can actually inject through that. So if you see an area that's that can use an injection, we can actually put it right there on the spot.
What kind of injection are we talking about?
So you can do things like steroid, but you can also do the regenerative treatments like platelet injections and stem cell injections through the camera. So really much more focused, hits this right on the direct spot, so you're not just kind of throwing it everywhere.
Wow,
Yeah.
that's cool.
Yeah.
Do you want to talk about the PRP? Or?
Sure, yep. Yeah, and then we also do our regenerative therapies. So the two mainstays of regenerative treatments are PRP, or platelet-rich plasma, which is where we draw your blood just like you're going to the lab. We take the platelets out just through a simple centrifuge. It spins away all the other parts of the blood, and we take the platelets off. It's a concentrated dose of platelets, so it's usually about 10 times the normal dose. Your platelets are your healers in your body. So, so in things like our tendons and our ligaments and certain chronic areas of injury, the blood supply isn't very good. So what we're doing is we're putting the healers in the blood in places they can't normally get to in large amounts. And what that does is it actually helps heal the tissue. And a little bit past that, we have our stem cells. Okay, so our stem cells are the cells in our body that can become different types of cells. So we have certain stem cells that can become muscle and bone and ligament, and then we have other stem cells that become different parts of your blood. And you can use one or both of those type of stem cells and put that into an area of injury. And when you put that into that area of injury, the stem cells actually start becoming the tissue of the surrounding area. They also will replicate, so they try to make more of themselves for a very long time. Sometimes for years, they find that their stem cells are still alive and active in those areas, and they just help the tissue heal. It also works very well for osteoarthritis, so it works great for knees and hips and shoulders, and really you could bring it to anywhere, any injury or any area of pain, and it does really well. One of the newer things that they're doing now is they're actually using umbilical stem cells. So, when a baby is born through a healthy cesarean section, the mother actually will donate the umbilical blood and tissue, and they basically put it through a process where it doesn't reject. They test it for any disease, and then it comes to us cryogenically frozen, and then we thaw it out and we inject it right in there, and you're getting about 30 million of the healthiest, youngest stem cells you can get to an injured area, and it really helps heal those areas. One of the other things that they do as well is the amniotic fluid and membrane. So they do a similar process where they take the amniotic fluid and membrane, they process it, and then they deliver it to us, again, cryogenically frozen. We thaw it and we inject into those areas.
Damn. I mean, yay! Impressive.